My name is Dr. Minesh Mehta. I'm a Deputy Director and Chief of Radiation Oncology at the Miami Cancer Institute, Baptist Health, South Florida. So I have a maternal grandfather who worked as a village physician in India. Rounding with him and working with him, I realized that with very little, he could do a lot. And he inspired me to understand that there were much broader challenges, much greater challenges, and technology and science would lead one to much greater adventures in medicine. Without empathy, there is no way to relate to the patient. And if you cannot relate to the patient, you cannot understand what the patient is going through. And if you don't understand what the patient is going through, it's very hard to meet their needs and their requirements. As a consequence, I have found in my experience that the most successful oncologists are not only the ones that are most brilliant, but they're the ones who are most brilliant and bring a bucket full of empathy to the table with them. This was a patient who was fully functional and was then diagnosed with a rare tumor known as a chordoma, for which he underwent surgery and proton beam radiation therapy at another institution several years ago. Subsequently, his tumor came back, he relapsed, and he came in to see me, and at first, multiple experts felt that nothing could be done for him. We took the risk, put him through a second surgical procedure, and put him through a second round of proton therapy. And this was the only therapy that could safely retreat this tumor in a very critical location. This patient is now alive several years later. He has two beautiful children. He's a functioning fireman, and it's a joy to see him on a daily basis.